Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. We're talking about innovations in pulmonary medicine at St. Luke's University Health Network. Tonight, we'll be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at innovations in pulmonary medicine offered at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Deborah Stallnecker, who serves as the medical director for St. Luke's Interventional Pulmonary Program and has expertise in advanced lung procedures, including bronchoscopy lung volume reduction and robotic lung scope. She earned her medical degree from the Philadelphia College of Osteopathic Medicine, completed her internal medicine residency at St. Luke's University Health Network, and her pulmonary and critical care fellowship at the Medical College of Virginia. Thanks for being here, Dr. Stallnecker.
Thank you.
So tell me about your role in pulmonology and critical care medicine, and what do you do as a physician in those areas, and how did you become interested here?
So the nice thing about pulmonary and critical care is I get to see patients in all aspects of their stages of health and sickness. So I get to see patients in the office when they're feeling well, and then if they have problems or flare-ups in their lung disease, we can take care of them in the hospital, all the way to where if they become very, very sick and end up in our intensive care unit. The other thing that I really enjoy about our specialty is that we can also perform procedures that can help diagnose and treat our patients with different lung problems that typically affect their breathing.
So really comprehensive care within the field. Thanks for being here. Joining our panel next is Dr. Rahul Mehta, who specializes in advanced bronchoscopy, including endobronchial guided ultrasound. He earned his medical degree at St. George's University and completed his internal medicine residency and pulmonary and critical care fellowship at Drexel University. His professional interests include advanced treatments in asthma and advancing techniques in bronchoscopy. Glad to have you here, Dr. Mehta.
Good to be here.
So can you tell us what are some of the common respiratory conditions that you see, and when is it time to go seek out pulmonary care? Do you need a referral? What's the line that makes you say, I need extra help?
Yeah, I think that the first step in evaluation is always with your primary care physician. The most common diseases that I tend to take care of are things that are what we call obstructive lung diseases, so asthma and COPD, as well as any abnormalities that we see on CAT scans of the chest, so things like lung nodules and abnormalities in lymph nodes. In terms of a referral, certain types of insurance do require a referral, but I'd ask your primary care physician about that.
Always good to start with primary care. They'll refer you where you need to go. All right, thanks for being here. Let's meet our final panelist, Dr. Thomas Sanders, the Program Director for the Pulmonary and Critical Care Fellowship at St. Luke's University Health Network. A native of the Lehigh Valley, Dr. Sanders earned his medical degree from the Philadelphia College of Osteopathic Medicine. After graduation, he was an active duty officer in the U.S. Army. He went on to complete both an internal medicine residency and pulmonary and critical care fellowship at Brooke Army Medical Center in San Antonio, Texas. Dr. Sanders has a particular interest in system methods to reduce morbidity within the intensive care unit, acute respiratory distress syndrome, and mechanical ventilation liberation. Thanks for joining us, Dr. Sanders.
Thanks for having me.
What is your role in managing and improving the health and quality of life in a patient who is having advanced lung disease? What do you do in that situation?
Well, I think there's, a lot of roles in that, and a lot of it comes down to, comprehensive care, not just of the patient, but also of their family members as well. So whenever anybody's suffering with significant lung disease, be it either in the intensive care unit or as an outpatient, that can create a pretty significant burden on the patient, their well-being as far as being able to do regular activities of daily living, as well as, an impact on their family members. So what I view as is, not only just, symptom management, but also coming to terms and understanding what their disease progression may look like and allow people to have time to comprehend and understand their complex diseases.
So important to include the whole family. I think that's really great that you do that. Thank you all for being here, giving us some great background information on your expertise and your interest in pulmonary medicine. All right, up next, we'll dig deeper into specific diagnosis and treatment. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Interested in a medical career? Consider St. Luke's if you want to be a doctor or a nurse. Based in Bethlehem, Pennsylvania, we are the area's only 4-year medical school and the largest provider of medical residencies and fellowships, and the country's longest-running school of nursing, trained at an organization that is nationally recognized in education, patient care, and quality. See why we are ranked the nation's #1 teaching hospital. Where you train matters. The best doctors and nurses train at the best hospitals. St. Luke's University Health Network.
The oldies are back. The Valley's new Real Oldies 1470, your home for the hits of the 60s and 70s. Motown, soul, and rock and roll, plus those great 70s disco hits. Join Craig Stevens every morning and me, Mike Mittman, every afternoon from 3 to 7 for a wild ride home. All powered by St. Luke's University Health Network.
The greatest hits of the 60s and 70s. Real Oldies 1470.
Hi, my name is Dr. Douglas Corwin. I'm a pulmonary critical care specialist at St. Luke's University Health Network. As a pulmonary critical care doctor at St. Luke's, I work on the inpatient taking care of the critically ill. I also see patients with respiratory or breathing difficulties on the inpatient side. We have excellent basic pulmonary coverage here at St. Luke's. We have a robust interstitial lung disease program where you get to see both a rheumatologist and a pulmonologist at the exact same time to help speed up the diagnosis and management of your disease. We have multiple conferences to help make sure that we have many minds taking care of one patient's disease where we come together and talk about it. At St. Luke's, we're on the cutting edge of technology. Navigational bronchoscopy is basically using a robot guided through the lungs to get to these small nodules, these small areas that may be cancer that otherwise we would be unable to reach. So it's helping us to make more difficult and diagnoses faster, earlier, and safer. One of the best things about St. Luke's is our approach. We're a team. We provide personal care close to home. We truly understand what your story is. We are responsive, available, and our job is to bring world-class pulmonary care to you.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Deborah Stallnecker, Dr. Rahul Mehta, and Dr. Thomas Zanders. We've learned a little bit about their expertise. Now we want to dive a little deeper into pulmonary medicine at St. Luke's. All right, Dr. Zanders, I'm going to start with you. Are you seeing more people with respiratory issues, and do you think this is a result of environment or population aging? Is that happening?
Well, I think, over the past summer, I think noticing the wildfires from, Canada certainly put a highlight onto those with any kind of respiratory disorders, but also those that, are otherwise healthy. The quality of air definitely can affect them on a daily basis. I also think, after the, COVID pandemic, that people pay a little bit more attention to their respiratory status, as well as those that have had, respiratory infections are a little bit more common now.
Yeah, it certainly made us much more aware of our lung health and breathing issues that you might have had associated with COVID. Dr. Stallnecker, I want to ask you about technological advancements that have made it a little bit easier for people to maybe care for themselves at home. What are the things that we can do to be safeguarding our lung health on a regular basis?
We use quite a bit of technology to help us both diagnose and treat our advanced lung diseases or even basic lung diseases. One of the most important technological advances that we utilize now are CAT scans. So they're specialized scans of the lung that we focus on lung cancer screening. So in our patients that we know have high risk of having lung problems, particularly patients who have smoked for a long time, we use the technology to our advantage to identify lung cancers earlier, and that actually helps save lives.
When you mention technology, Dr. Mehta, I want to ask you about using imaging tests, lung function tests, and also even exploratory surgery that helps you diagnose conditions. Can you help explain some of those diagnostic tools that you use?
Yeah, so personally I use things like CAT scans and PET scans all the time. I know my colleagues as well. We look at these imaging tests quite frequently. When we talk about a CAT scan, I'm often looking at abnormal tissue in lungs. And I can use that information to decide whether or not it's appropriate to send someone for another type of test, a more invasive type of test, something like a bronchoscopy. or we take a small scope about the size of my pinky with a camera at the end of it, and we can look directly into your lungs. From there, we could decide whether or not it's appropriate to do biopsies of such.
So doing the tests in stages to determine the next step is really important.
Right.
You know, Dr. Zanders, you mentioned COVID-19, and there have been an increase in long-term pulmonary issues after COVID-19. What are you seeing, and what types of issues are you diagnosing and treating?
So there's obviously, a big concern as far as, long COVID and the chronic fatigue associated with that. I will say that, for the most part in my practice, what I'm usually seeing outside of the initial wave of COVID, where people really those that survived, had a pretty significant amount of lung scarring. Subsequent waves seems to be much more related to more of an asthma mimicker, where they start having bronchial constriction, wheezing. But I also think that there's a very large component of the fatigue factor after having such a severe, viral infection. For those that were in the intensive care unit or potentially admitted for a long period of time, then, we really do focus in on rehab. And I would say that, a lot of people, or most people, actually do recover to near 100%, if not 100%, after the initial infection.
That's really good news to hear, and I think it's helpful for people to stay on the path of recovery, even if it's a long time. Speaking of recovery, Dr. Stallnecker, we're talking about breathing problems being a major cause of hospitalization. How can pulmonary function testing help keep people out of the hospital, and really what is that?
So lung function testing is a way for us to be able to understand how much air is going into the lungs, how well it can come out, and that's really important for us to diagnose some of the common lung problems we see, like asthma, emphysema, COPD. And importantly, that helps us determine what medications patients can stay on, so that can prevent their lungs from either becoming more scarred, more damaged, and ultimately hopefully keeping them out of the hospital, so that the lung function testing really does help us identify what treatment will help our patients.
Staying out of the hospital is always the goal, but sometimes that's not possible. So Dr. Mehta, tell me about your team's multidisciplinary approach to diagnosing and treating lung conditions, especially when someone might have to have multiple physicians or be in the hospital.
Yeah, we're very fortunate here at St. Luke's to have a multidisciplinary approach to different types of disease conditions, things like cancer and interstitial lung diseases in particular. We meet on a twice-a-month basis as a group of multiple different physicians, pulmonologists, radiologists, to discuss different types of cases and whether we need to do further testing or go directly to treatment with some of these diseases.
Great information from all our panelists, but we're not done yet. After the break, we'll learn more about pulmonary medicine at St. Luke's. You're watching St. Luke's Health Now. Stay tuned.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
St. Luke's School of Nursing prepares their graduates for any role. Really, there are no limits to where your education can take you.
If you're going to be a nurse, you want to be the best nurse possible. If you want to be the best nurse possible, you should go to the best nursing school possible. And St. Luke's, as being a part of the #1 teaching hospital in the country, is the best nursing school that you can consider.
Hi, my name is Susan Steiner, and I have received Pulmonex Zephyr valves at St. Luke's with Dr. Stallnecker. I was diagnosed with COPD in 2012. In 2020, I started to decline. I found Dr. Deborah Stallnecker at St. Luke's, and I saw that she was doing Zephyr valves. I was ecstatic because number one, it's in my backyard, and number two, there's a female physician doing this, and she seemed to be doing it so well. They're on the cutting edge of everything right now, and they were the first in this area to do the Zephyr valves. So in July of 2022, I went in to have my first set of Zephyr valves put in. I can't tell you how wonderful I feel. In July of this year, we went back in and she did put 4 more valves in my left lung and have no breathing problems at all. It would not have been possible without Dr. Stolnecker. My family was so impressed with her as a physician and with the staff at St. Luke's because they just treated us wonderfully. Anyone who has pulmonary issues, I will recommend to her because she's a fantastic doctor.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show tonight. We're talking about innovations in pulmonary medicine at St. Luke's. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Stolnecker, Dr. Mehta, and Dr. Zanders. Thank you all for being here. In the beginning of the show, we talked a little bit about your expertise and your backgrounds, and really what you love about what you do. But now we want to talk a little bit more about the techniques and the innovations in pulmonary medicine. So let's dive in. What are some of the new medications that are out or on the horizon to treat patients? Because I know that the medication is so key to really maintaining the illness.
You know, we're really beyond the basic treatments in a lot of these diseases that are so old now. Things like asthma that were routinely treated with the same thing for so many years. We now have very advanced therapies to treat things like this. Just in the last decade or so, we've come up with treatments really looking for the specific cause of the asthma as opposed to just treating all asthma separately. Patients that I see routinely get a lot of blood work done and really trying to narrow in particular triggers for that patient's asthma as well as the inflammation that's causing it. So I tend to really focus on the cause than just treating all symptoms equally.
Which is really important because the inflammation continues that process on and doesn't help it stop. So that's great. Great to hear. Dr. Zanders, I know that St. Luke's has some minimally invasive technologies to examine lung disease, to diagnose. Tell me a little bit about that, how that works and why minimally invasive is a good thing.
When we want to talk about, earlier we were talking about some of the lung function testing and things like that. Those are very minimally invasive, such as pulmonary function testing. We can do other tests such as a cardiopulmonary exercise test, which really helps get down to, what is the etiology of somebody's, shortness of breath or their dyspnea. Because oftentimes it can be related to many different things, be it either cardiac disease, pulmonary disease, or sometimes even, neuromuscular disease. And that helps us define exactly what's wrong with the patient. When we talk about other kind of, minimally invasive procedures, I would include bronchoscopy into that. For the most part, bronchoscopy, as Dr. Mehta had said, is a small camera that goes usually through the nose or the mouth. It does require some sedation, but for the most part, it does not require any incisions or anything else like that. And I would include that into minimally invasive as well.
Amazing what minimally invasive techniques can do. And Dr. Stolnecker, I know that you do something called BLVR. Can you tell us what that is and how it helps patients?
BLVR stands for bronchoscopic lung volume reduction. We say valves for short because it's easier to say. And basically what happens with emphysema is the lungs fill up with too much air. And so these tiny valves that are about the size of the tip of a finger can be put into the most diseased parts of the lung to let the air that is being stuck in there escape. And what that does is it allows the healthier parts of the lung to function more effectively in our patients with advanced emphysema.
That's awesome. And how often does a patient get that type of procedure?
So in order to qualify for this procedure, we do the lung function testing as well as a series of other tests, including some of the scans that we've already talked about. And this is really reserved for our most advanced COPD patients. This is certainly not for all patients with COPD, but we evaluate patients and identify if this is something they may benefit from.
Dr. Zanders, I'd like to ask you about a lung cancer diagnosis, because we've talked about certain things like asthma and COPD, but how does the team work together once someone has received a lung cancer diagnosis?
So obviously, that's a life-altering, event when somebody receives the diagnosis of lung cancer. Oftentimes, this is initially seen during a, lung cancer screening CAT scan, but others are advanced or diagnosed at a fairly advanced stage. And so what we do is we do a multidisciplinary team approach. Weekly, we have a thoracic board that meets with both our radiologists, our pathologists, pulmonologists like ourselves, and then our cancer specialists, being our thoracic surgeons, radiation oncologists, and our medical oncologists. And based upon imaging, patient history, lung function, and other medical illnesses, we then come up with a comprehensive treatment plan for that patient.
Dr. Maida, how do you care for patients who have severe lung disease? They've been fighting a long time and they've really exhausted their options. What do you and the team do at that point?
Unfortunately, sometimes, despite great pulmonary care, some diseases just can't be improved, and sometimes they won't even stabilize. And unfortunately, those patients often require lung transplantation. We have a great relationship with Temple University Hospital in Philadelphia, and they often assist us in lung transplantation. We have very dedicated pulmonologists in our group that are helpful in coordinating both before as well as after that transplantation to help coordinate and guide that process, as well as stay in contact with the physicians over at Temple.
Dr. Stolnecker, you mentioned in the beginning of the program one of the things you love is the comprehensive care that you can give someone in all different stages of illness and disease. What is your best advice to patients of any stage of anything that they're suffering with their lungs or concerns that they have? What is your best advice for them?
I think having open communication with your whole medical team, including your primary care physician, the pulmonologists, family, as Dr. Zanders mentioned earlier. I think having that open communication, back and forth conversation about concerns, a lot of times patients are fearful to ask questions they may not want to hear the answers to, but we're always here to make sure that they're most comfortable with their care and what their plans are moving forward.
And really, your treatment plans are only as good as the information that you have, and a lot of that is patient dependent.
Right.
Great advice from all of you. Thank you so much for such an engaging conversation. Up next, we'll get questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
Hey guys, Mr. Wellness here from the Wellness 101 show. Join me as we take a quick step-by-step journey of basic tips and tricks on how to stay healthy. From developing easy healthy habits to surviving allergy season and everything in between, the Wellness 101 show is fun, educational, and designed to help you thrive. Be sure to subscribe to our YouTube channel by scanning the QR code and hit the bell icon to be notified of any future episodes. It's time to make healthcare fun with Wellness 101.
St. Luke's continues to make sure patients always have access to leading medical technologies, no matter where they receive their St. Luke's care. St. Luke's recently cut the ribbon on a fleet of the most advanced ultrasound technologies from GE Healthcare, raising the bar of imaging and ultrasound to a level not seen in the U.S., creating consistency in radiology, vascular, and cardiology services throughout the network.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about pulmonary medicine at St. Luke's University Health Network. Now we will read some questions from our viewers. You guys ready? All right, Dr. Stolnecker, I'm going to start with you. My 60-year-old mother was a lifelong smoker, only quitting 2 years ago because she is constantly getting bronchitis. Will her lung health improve now that she is no longer smoking?
So she did the best thing she could have done for herself by quitting smoking. We know that we all reach our personal best lung function in our 20s, and we all lose some lung capacity as we age. Unfortunately, in individuals who smoke, they often lose that lung capacity at a faster rate. But the good news is now that she's quit smoking, she'll go back to losing lung capacity at the same rate as anybody else. But it's also very important that she talk, if her symptoms of bronchitis are still continuing, she should see her doctor about getting that lung function testing and see if perhaps there's something that can be done to help improve her capacity now.
Good, not just the quitting, that's really important, but there could be something that could help her more. Good. All right, Dr. Maida, this is for you. This viewer writes, I've never had breathing issues, but I was diagnosed with a mild case of asthma as an adult. Is it common to develop asthma as we age, and what can we do to keep symptoms under control?
Yeah, it's a great question. It's certainly not common. I wouldn't say it's common to develop asthma as we age, but it's not as rare as most people think. Certainly asthma can happen at any age. Most people associate that with younger age, however, it can certainly happen as you get older too. I think it would be really important to evaluate this patient with a pulmonologist that has some experience with asthma and to really make sure that this is truly asthma that we're dealing with, as there are a lot of things that mimic asthma. If this is asthma, there are certainly medications that can help.
Really interesting. I didn't know there were things that could mimic asthma, so good to get it checked out. All right, Dr. Zanders, this question is for you. I live with rheumatoid arthritis and am now experiencing breathing problems caused by scarring of the lung tissue. Can this be managed by medication or do I need something else?
So actually, I mean, rheumatoid arthritis is one of the most interesting diseases because it truly is systemic and can affect not just the, joints and bones and muscle tissue, but does have a very high predilection for involvement in the lung. Certainly lung scarring can occur. There's other things such as lung nodules or even fluid around the lung tissue itself. So, there are certain medications. Everybody's situation is a little bit different, especially if there's immunologic medications that are being used to treat the rheumatoid arthritis. If somebody is having breathing difficulties with one of these autoimmune diseases, they really should be seen by a pulmonologist.
So don't ignore it, they could be related.
Absolutely.
All right, Dr. Maida. This viewer writes, I was one of the unlucky people during COVID-19 and wound up in the hospital with pneumonia. 2 years later, I still have a dry cough and shortness of breath on occasion. Will this ever go away?
That's a tough one. This patient's experiencing something that millions of people are dealing with right now. She's describing something called PASC, which is post-acute sequela of COVID-19. It's very difficult to deal with, to be completely honest. Most of these patients tend to get better on their own, usually within months, sometimes within years, and sometimes it lasts a little longer than that. It's very important to be seen by a pulmonologist and get down to the cause, the real cause of this cough, because a cough after COVID-19 isn't all the same thing. And so I think having that evaluated may be very beneficial.
Great advice, and it is something millions of people are dealing with. All right, Dr. Stalnecker, you hear about artificial intelligence all the time and how it's making people's lives better. Is St. Luke's using AI specifically in pulmonary medicine?
So in some ways, both in the hospital, we have some technology that can monitor our patients, that can alert us to problems even before they become more serious, without necessarily the doctors or the nurses having to be watching constantly. So we have that monitoring technique. We also use advanced technology that I think is really important in terms of when we talk about bronchoscopy. Dr. Zanders had mentioned bronchoscopy. We have the next generation of bronchoscopy, which is robotic bronchoscopy, which allows us to navigate into the lungs, into further parts of the lung than our standard scopes that we've already talked about can get us. So while it might not be artificial intelligence, it really has changed the landscape of how we can evaluate our pulmonary patients.
Technology is amazing and always advancing. All right, our last question, Dr. Zanders. I've always been active and have never been a smoker, but I was still diagnosed with COPD. What could have caused this, and what advice can you give me about caring for my condition?
So although it is unusual for somebody to be a lifelong non-smoker and active and to be diagnosed with COPD, there are a few rare genetic diseases and some occupational exposures that can predispose somebody to develop COPD. Given the rarity of that, I would really recommend an evaluation with pulmonary function testing and a pulmonologist to really ensure that it is COPD or chronic obstructive pulmonary disease and not one of the other disorders such as asthma or an interstitial lung disease, because being diagnosed with COPD as a non-smoker is pretty unusual.
Okay, great advice from all of you. Before I let you go, I'd like to ask each one of you what it is you love best about what you do. Dr. Stalnecker, I'll start with you.
The patients. I love being able to help them through all parts of their journey.
All right, Dr. Maida, what about you?
Certainly patients, as Dr. Stalnecker had mentioned, and their families as well, who often need just as much support as they do.
Great point. And what about you, Dr. Zanders?
Again, as both my colleagues have said, obviously, we wouldn't be here if we didn't enjoy and love for caring for our patients and their families. But, I also greatly enjoy, teaching and being able to, advance the next generation of physicians in this field.
Wonderful and so important. Thank you all for all that you do on a daily basis for the people of the Lehigh Valley and St. Luke's. Thank you so much. For more information on pulmonary medicine at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.